Hey, this is Dr. Jeff Dolgus, and today I want to show you an exercise that has really helped me in my struggle with my own TMJ problems to relax my jaw and take pressure off my jaw joints. I call this exercise the tongue bracing swallow. So let me tell you a little bit about this exercise, where it came from, why I think it works, and then I'll show you how to do it. When I started treating TMJ patients exclusively in 2011, I started noticing a pattern in some of the previous dentist's notes, and there was something that kept coming up called the tongue bracing swallow. Now this would come up during an electronaphological exam in which we do jaw tracking to see the patterns of movement that the lower jaw and the tongue muscles and the jaw muscles go through when a person does normal daily functions like talking, chewing, and swallowing. Now when I asked what a tongue bracing swallow was, the answer I got was that it was a dysfunctional movement of the tongue or dysfunctional usage of the tongue during what would otherwise be a normal swallowing pattern. So here we have to establish what is a normal adult swallowing pattern. What we think is supposed to happen when a person swallows is that the teeth will come together, the tongue will lift up against the roof of the mouth and then roll back so that the bolus of saliva that's in the mouth gets rolled toward the back of the throat. It gets deflected by the soft palate and the epiglottis, or the uvula, down the throat, and then the muscles that attach to the hyoid bone, which is right here, elevate and pull forward or protrude the hyoid bone so that the epiglottis folds back, covers the trachea, and shunts the bolus of saliva or food anteriorly so that it can go down the esophagus and into the stomach. So if you try swallowing right now, just gather a little bit of saliva in your mouth and go ahead and swallow. What you should notice if your swallowing pattern is mechanically stable and normal is that your teeth come together, your jaw muscles clench, your tongue goes up, it rolls back, and your throat muscles move the hyoid bone or the laryngeal prominence up and down. Now here's the interesting part. For a person who has jaw joint dysfunction or a problem within the structures of the jaw joint itself, putting the teeth together can be problematic. So if when you put your teeth together, the jaw joint is damaged or irritated in that process, then every time you swallow, you're damaging or irritating your jaw joints. Now take into consideration that we swallow 2,000 to 3,000 times a day on average. That's a lot of irritation for jaw joints that are under distress. So now I'll tell you why I think the tongue bracing swallow was explained to me as a dysfunctional pattern. What was explained was that the tongue wants to protect, or the nervous system wants to use the tongue to protect the jaw joints during that swallowing pattern. So the tongue will be moved in between the teeth so that the teeth don't come all the way together. And in essence, what'll happen is you'll bite your tongue a little bit when you swallow. Sometimes people move their tongue forward when they swallow, and that seems like it's more of a pattern to create a seal than it is to brace the jaw because of inflammation in the jaw joints. So now think about that number, 2,000 to 3,000 times a day. If a person is doing this with their tongue, they're either moving their tongue sideways in between the teeth and kind of biting on it every time they swallow, or they're pushing their tongue forward every time they swallow. That over time is going to change the shape of the upper arch and the position of at least the upper teeth and maybe the lower teeth. What we'll see in these cases is people who bite their tongue a lot or use their tongue as a cushion in between the teeth during the swallow will have little scallops on the sides of the tongue that make it look like a pie crust. People who have a thrusting of the tongue forward when they swallow will usually display what we call an overbite, or what people typically call an overbite, which means those upper front teeth will become flared. They'll flare outward. Sometimes the lower front teeth will also flare outward, but sometimes those lower front teeth will tend to fold backwards. And that depends a lot on what the lips do in response to that altered tongue position and the altered jaw position during that swallow that's happening thousands of times a day. So now think about this. You didn't always have teeth. If you have teeth now, there was a time when you were an infant where you had no teeth, but you could still swallow. So what did you do if you didn't have any teeth to brace the lower jaw and stabilize it so the muscles can move that hyoid bone up and down and move the epiglottis to block the trachea? What you would do would be to push your tongue up and use the tongue as both the movement apparatus and the stabilizing agent. What's cool about that is you can do that now even if you've got a full complement of teeth. You can intentionally swallow using your tongue to brace and stabilize the lower jaw rather than using the teeth together to brace and stabilize the lower jaw. If you do it on purpose and intentionally, then you can develop functional patterns that are consistent with good tooth position and comfort of the muscles and the joints, rather than dysfunctional patterns, which is usually the default mechanism of the body, which will tend to pit one part of the body against another part of the body. It will cause compensation, and even though one structure might be protected, you'll have problems with other parts of the body that are on the outskirts of the periphery of that functional movement pattern. All right, now to the good stuff. This is how you do this exercise. What I want you to start with is a normal swallow. You need to be able to observe what your normal patterns are in order to determine whether or not a correction is even appropriate for you. So with a normal swallowing pattern, you should feel these muscles here, the masseter muscles, clench, fire, or expand outward when you swallow. So it should look like, okay, so you can see my fingers move when I did that. Now I want you to swallow without your teeth coming together. So gather a little saliva in your mouth, and I want you to lift the saliva to the roof of the mouth with your lips open and your mouth open and hold it there. And then try to swallow without your teeth coming together and without your lips coming together, and notice what happens. You should notice that when you swallow using your tongue to brace the mandible, you don't have as strong of a contraction of the elevator muscles, meaning the masseters and the temporalis muscle, and you also don't feel as much pressure on the jaw joint structures, which are here in front of your ears. I do this exercise many times every day to get myself into a pattern of protecting my damaged or compromised jaw joints from constant and repetitive irritation and trauma. What I don't want to do is I don't want to develop a dysfunctional pattern. So if I do this deliberately, all I'm doing is trying to teach my body a way to be able to swallow that's both functional and appropriate. Now there's another aspect of this that you might notice when you begin to get a hang for this tongue bracing swallow, or TBS for short, that has to do with the posture in your cervical spine, your upper back, and your neck, and where your neck vertebrae attach to your skull. You may notice that when you swallow this way with your tongue up within the boundaries of the maxillary arch, when you swallow there's a little bit of a lift that happens, and it almost feels like it pulls upward on your spine, lengthening the cervical spine and improving your posture. And that has a positive impact on your appearance, and who doesn't want that? Now for those of you who have dry mouth or have difficulty producing enough saliva, you can try this with water, but be careful not to use too much water. Take a small sip of water, and kind of like I had you do in my previous video about the tongue shrug, you'll hold the water, elevate the water up to the roof of the mouth, hold it there, paying special attention for the purposes of this exercise to your tongue being within the boundaries of the upper arch. You do not want your tongue to be flaring out, laying flat, or pushing forward. Really practice that tongue position. In Tai Chi, that's called tongue resting gently on the roof of the mouth. I'm excited for a lot of people to see this video and try practicing this exercise. It's made a huge impact on my life and the way that my jaw joints feel and function. So I hope that you enjoy this, and I hope you're able to use it every day. If you like this video and you want to see more, please hit subscribe below. I'm Dr. Jeff Dolgus, and I'll see you next time.